Hey everyone, welcome back to Therapist Uncensored. I'm Ann Kelley, and our guest today is Kim Barthel. She is an occupational therapist, author, speaker who specializes in working with trauma and has so for many, many years. Welcome to the show, Kim.
Hmm.
Um,
And thank you so much for having me
I'm
to be a
so
part of your podcast of like-minded beings. It's indeed an honor to be with you.
uh, well in your credentials, I want to say, and a delightful woman. And you describe yourself, which as someone who supports the conscious evolution of the human spirit. I love that.
Mm,
I want you to unpack that for us.
for sure. I think that in our company's mission, our company is called Relationship Matters. And in this mission of supporting the conscious evolution of the human spirit, we know that the only person you can change is yourself. And people always say to me, what is it like to be conscious?
Mm,
And I say, well, it's connecting to something in my own body, my own being, that I wasn't aware of a moment ago. And with each moment of new knowing allows me to meet others and the world around me in a different place.
mm,
So that form, that's the base to me of regulation and relationship.
mm,
Is
mm.
how do I show up in connection with those in my world, in the world around me, from the place where I can be my best self.
That's beautifully stated. And it's not always easy, is it?
Oh no.
No matter how much we want to or how much we think we are, it's a powerful journey to be able to do that.
It's again a mission, which
Yeah.
means that, like every vision, it is something that is never ending.
Mm-hmm. Mm-hmm.
You are always looking towards and then reflecting on, but also from a place of self-compassion,
Mm-hmm.
of
Mm-hmm.
not always being capable of meeting that lofty mission. So it's that too is part of the evolution,
Mm-hmm.
is that self-compassionate space.
Mm-hmm. Absolutely. And as we listen to you, just your warm voice, and just I feel very inspired to go deeper. And people don't often associate that with like deep understanding of the neuroscience and deep use of the neuroscience, right? It's like there's so much out there of we're going to either talk really softly about the idea of connection, or we're going to be talking about the science, and you have an ability to integrate both. So,
Oh, I have to take that in first, that you just said that.
yeah.
And yeah, I think that connection is something that was in me.
Mm-hmm.
And a lot, I feel very fortunate, and not always from a place of ease. And the neuroscience, which is a passion, I don't know, I must have 6 or 7 past lives of trying to understand the brain. I don't know,
Uh-huh.
because it's just within my bones to talk about neuroscience.
Mm-hmm.
And as I weave those two together, it, for some reason, it allows me to deepen the capacity to put connection into action.
Mm-hmm.
The more I understand and appreciate the bridge of the science, it's almost like a permission giving that
Mm-hmm.
this unseen, uh, always hard to have evidence based practice in the unseen
Mm-hmm.
of what is connection to self, connection to other, connection to the environment, connection. What is it? And when that information that comes from our knowing about the brain and the physiology of mind body connection, it's like a portal that
Mm-hmm.
opens us up to acceptance and validation of what we know inside of us
Mm-hmm.
intuitively as human beings. So science has always been a window for me to help others even want to journey on this adventure of deepening their own self-understanding.
Mm-hmm. That's beautiful. Well, you wrote a book. You were telling me a little bit about it. Give us a little, and it was really centered on a man's evolution through trauma. And maybe we could start there. Tell us a little bit about the book.
Oh, one of my 42 years of practice adventure,
Yeah.
writing a book. As you know,
Yes, yes,
right? As
yes.
you know, writing a book is an adventure. And the name of our book is called Conversations with a Rattlesnake. And I wrote it together with a friend, colleague named Theron Fleury, which to
Mm-hmm.
the American audience, you may or may not know him, but in Canada, where I am from, he is a Canadian icon.
Mm.
Hockey in Canada is next to God in some ways. And so Theo Fleury was sexually abused by his coach in junior hockey. And throughout his magnificent career as a professional athlete, he was well known not just for his skill and amazing being on the ice, but for his drama and
Mm-hmm.
addiction to drugs and alcohol and gambling and sex. And he always says if there's an AA group out there, he belongs to it. And in the end of his professional career, he shared with the public his story
Mm-hmm.
of the why his behavior was the way that it was. And we met. He listened to me talk at a conference. And in true confession, I have no interest in hockey. So he walked up to me at the end of my little session and said to me with this huge presence, "You," with that voice, standing right in my face, uh, "you have just changed my life, and you're probably going to work with me for the rest of yours." And I was taken aback by this powerful presence, but I also didn't know who he was
Mm-hmm.
in that first minute. And then when he introduced himself, the story was known. And that began our conversation. And so the conversation is like two people sitting at the coffee table, having coffee. It's not a therapist client dialogue, but it is written in conversation style, sort of like Tuesdays at Maury's,
Mm-hmm. Mm-hmm.
where he shares parts of his journey and I provide him with some scientific exploration and reframe and connection. And then it's also my turn to share into some of the complexities of my own experience. So it's truly a dialogue, a deepening dialogue across many chapters that allow the average everyday person the feeling that they too can step into self exploration from a place of hope and belonging rather than fear, terror, and isolation.
Mm.
And that was our goal. And we wrote it in 2014. It was published in 2014. So it's had a life already in many different places around the world, and has been both an inspiration to people, but also was part of our own personal supporting the conscious evolution of the human spirit in
Mm-hmm.
both Theo's and my own personal lives.
Well, being able to know that that book has had quite the impact for so many men in particular, right? Because the idea of talking about your own personal trauma and how it can impact your body in all these seen but many unseen ways. And
Oh,
his,
for sure.
yes, and his ability to come forward and for you all to sit in conversation in such an open way really does, an icon and an athletic icon. It's so, especially in 2014, um, that was really powerful experience. And I understand that some of what was really helpful for him was to understand the science, that was a pillar in his ability to feel seen and connected. And
Oh, for absolutely.
yeah.
I mean, when we spoke about attachment theory, and I know that in your history of your podcast, you have had a conversation with my colleague, Dr. Pat Crittenden, who is my teacher in the
Oh,
field of attachment. And this is what Theo first heard me speak about, was adaptive protective responses,
mm-hmm.
and how our nervous system is so wise in protecting us. And instead of self-abuse and living in shame, that very reframe opened the door for him to begin the journey of self-forgiveness. And so the science, he would say, was pivotal in him settling in to the place of moving beyond resistance.
Mm-hmm.
And he had already been sober for a while, and the sobriety was not relieving of the suffering. And so he talks deeply throughout the book around being sober is step one
Right.
in his journey of healing, and how moving beyond addiction is a courageous self-inquiry that can only exist in safety.
Mm-hmm.
So I think science helps create some of that safety, especially when there's such an avoidance, adaptation, where feelings are so dangerous. Talking about feelings, sensing into feelings, being in one's body, which has been a place of danger.
Mm-hmm.
There is a true safety in information as a window into connection.
Right. Right. And science has such an ability to take out the shame and
Yeah.
increase the idea and even the motivation, because you begin to know you can't think your way out of things, right? As you learn more intellectually, you know so much more about what you don't have intellectual control over. And there's relief in that and understanding. Yeah.
Mm.
And so you have been working in this field for so long since that time, and you have grown so much, I'm sure, like all of us, in your understanding of the science. I know that you have an integral relationship now with polyvagal theory and with Steve Porges. And I would love to understand that evolution and what you know now. What have you gained in your understanding about the polyvagal theory and trauma and helping people find the human spirit?
Mhm. That's such a fun question. I first met Steve Porges, and I don't even know if he remembers this, but it was 1987.
Mm,
So I was just a newbie as an occupational therapist, and I was working in the neonatal intensive care unit in a hospital here in Canada. And Dr. Porges at that time was studying the vagus nerve on preemies in the neonatal intensive care nursery.
mm,
And he was giving a lecture I was in Chicago, and I listened to him talk about the vagus nerve and the heart. And this was early on in his own career, as how this branch of the vagus nerve, this brainstem mind body connector, he wouldn't have used those words in 1987,
right.
was this connection between heart rate regulation and arousal. And I was like, my ears just perked up. And at that time in the nursery, there was so much ambivalence about when do we take babies off their life support? How long do we medicate them with certain medications? This was such a new field.
Mm-hmm.
And he made this profound statement that the vagus nerve doesn't fully myelinate or mature enough in its job to support the heart until 32 weeks gestation. And all of these preemies that were sitting in front of us in those days were 27, 28 weeks. And this is where we were no longer going to take this risk with this very profound game changer in understanding the innervation of this physiology. So this was my first meeting. And then a very large time passed in between. In 2012, I was at the Dalai Lama's Science of Compassion conference in Telluride. And I sat beside Steve Porges at this conference. And, you know, it was a little bit, oh my gosh, I remember you when.
Mm-hmm. Mm-hmm.
And he started to speak about his polyvagal theory and its connection to compassion. And in that venue, I mean, the polyvagal theory has so much application across so many far-reaching ways of understanding the human being. But in that context, the relationship between human connection and the social engagement system and the capacity for empathy and compassion was the center of the dialogue. And this was a very profound meeting for me with him, in that he gave me a copy of his chapter that was not yet published on what he was presenting. And this was a game changer for me, because as I was reading this paper, it was like words put to a knowing
Mm-hmm.
of the criticalness of how our innate ability as humans to be in relationship is the center of how we create this way of healing, this container of healing that comes through the relationship rather than an action.
Mm-hmm.
So many of the thoughts I was having at the time, 2012, was it's not about what we do, but how we do it. And as an educator of clinicians, I would always use those words, you know, that our relational skills are really, and I use the word, the magic of the theories that
Mm-hmm.
we bring to our clinical work. But at the heart of it is us.
Right. It's the relationship.
Yeah.
Right.
And that always
Yeah.
sounded so fluffy.
Yes, it
And
can
right
it? It's just
in the
about the
early
relationship.
2000s, it sounded,
Yeah.
you know, just before, I was listening to Dan Siegel and Bruce Perry and Alan
Mm-hmm.
Shore and people that sit, you know, on my shoulders every day. Their voices are in my mind every day.
Mm-hmm.
But
Mm-hmm.
this dialogue was opening up. But the
Mm-hmm.
compassion part, or the capacity to see another through the eyes of compassion, needing its roots in this space of the polyvagal theory, was really a deeper meaning for me. That to decrease even further our projection and transference within a therapeutic relationship came from this first being together with,
Mm-hmm. Mm-hmm.
and really helped me with all of my early learning around attachment theory. So those were my first introductions to polyvagal theory. And then the story just goes on and on and on. And a lot of it had to flow into the use of therapeutic use of music.
So say more about that as we start to unpack this. And I think you have this very unique perspective as an occupational therapist. There is so much that we talk about regulating one's body, getting connected to one's body, and an ability to do that is not so easy, especially for those of us that have sensory issues, neurodiversity, or as we were speaking before about the hockey player, you know, that has had so much pain that avoidance is such a dominating force that getting connected to the body and the sensory experience of it, that's not easy.
Oh, you said that so well. When I was a baby occupational therapist, my first love was the field of sensory integration. And the originator of that theory was Dr. Jean Ayres.
Mm-hmm.
And she was my mentor. I
Oh,
was in her very last cohort of learners before she passed. And in the field of occupational therapy, this is a pioneer. She was a
mm,
pioneer in helping us appreciate the role of the physiology of the body
right.
as it contributes to one's being. And so that's a 40-year adventure in the understanding of the sensory systems, the interoceptive consciousness of those systems as they play into meaning making of our lives.
So can you unpack that for those that
Mhm.
don't have as much familiarity with the language? What are you
Sure.
saying? What are you saying?
So the sensory systems, we often think of what we see, what we hear, the touch on our skin, and then there what we taste, what we smell. But there are also sensory systems that are not so well known and that are a little bit invisible. And one of them is called the vestibular system, which tells us, am I moving or are you moving? Where am I in space?
Mm-hmm.
Am I in a body? Is my body perceivable to me? And together with all the other systems, including another word we use, which is proprioception, the heaviness of my body. What does it feel like when I push and pull and move? What muscles are acting right now? This information tells me I'm a me,
Okay.
that I'm a me in this world separate from something else. So each of our sensory systems integrate in the brain together and give you a sense of you. And that is the beginning of consciousness, especially in a baby who is
That makes
beginning
sense.
to learn that I am separate from you. In fact, many of these sensory systems are fully developed in utero. And so the part of the developing baby's work, it's a funny way to say that about a developing baby. Developing baby's work is to learn that they are a entity that is unique unto themselves. And that connection, we take it for granted. That the information from within our bodies is constantly informing us. Am I upright? Am I, hanging upside down? Um, do I want to go over there and pick up that toy? Do I want to look at my mom? Do I want that food over there? All of our engagement in life relies on the integrity of this information.
And I would think even, am I separate from my mom? Am I a separate being from my mom? And learning that.
Exactly.
Yeah.
And you can see how important that is in attachment.
Well, outline that. How do you see attachment impacting our ability to develop and do that work?
Oh, love that question. So an infant receives all this raw data. Their tummy hurts, they might be tired, they might feel irritable, and they have no language other than their body signals, their
Mm-hmm.
affective responses that they display through their face, their vocal tones. Moms and dads know the differences between the cries
Mm-hmm.
and the sounds that their babies make. And in this dance of attachment, the adult mentalizes or puts their mind in the mind of the child. And they do the best they can with what they have in guessing what the child's experience is and then respond to that. Oh, you're hungry. Let me
Mm-hmm.
feed you. Or, oh, you're so tired, and let me hold you close and rock. That there is this back and forth, serve and return, that goes on between the child and the caregiver, that is based on interpreting these nonverbal cues that are coming from sensations within the baby. And then the caregiver makes sense out of it with their responses and also eventually with language. We talk to babies and they don't always understand what we're saying, but eventually they do.
Mm-hmm.
And they put together all the intonations and motherese and sounds with those sensations, and 500 million thousand times a day through the oxytocin system, there is this wiring in of this is what happens when I communicate this to you. So if a caregiver, doing the best they can with what they have, gets those cues fairly accurately,
Mm-hmm.
then there's a sense of being felt by the other, which creates safety and security. You get me. You feel me, I feel me. If, however, the caregiver is preoccupied with their own suffering and doesn't read the cues, can't read the cues, is activated by the cues, if their own sensory systems become charged in the presence of the mirroring from their
Mm-hmm.
infant, they may dismiss those cues, which then teaches the child to do the same. So, this is the sensation relationship in response to how it evolves in attachment.
So, as those processes are developing, which is why the early attachment years are so important, as this is developing, if they are, let's just, out of all those examples, let's say dismissed,
Yeah.
for whatever reason, the parent or the caregivers dismiss that experience, part of what you're saying, and this is what we're always trying to highlight, is that this isn't just this is not a cognitive decision that anyone's making, but the infant's nervous system, the infant's body learns to adapt, but it can impair the development of certain systems of being, like you said, this vestibular, the ability to know where that you are and how you differ. And so it deeply impacts our senses. And
Mhm.
that's really why it's so beautiful to be talking to an occupational therapist, right? Sue and I are therapists. I'm a psychologist. So we come at it from a different place. And what I really want to dive into is with you, how do we recognize that? Maybe even if we were to move into the adult world, how do we recognize when our system hasn't had the kind of integration or development? And then what do we do about that?
Oh, what a, oh, yeah, I know this is a podcast, but I'm like flapping my hands with such enthusiasm and appreciation for your comment and the question. You know, when you spoke a moment ago about the dismissiveness
Mm-hmm, mm-hmm,
or the miscue, it creates a disconnect for the baby in trusting, knowing, and connecting into those signals.
mm-hmm,
And so the pathway takes a different road. Martin Teicher, who's one of my heroes, he is a neuroscientist who has studied trauma and developmental trauma extensively. 5 years ago, he would say that early developmental trauma damages these circuits. Now, he says that the brain wisely adapts
yes.
and that the original pathway is not damaged, but a different road arises.
Mm.
I love that
Oh, I
because
love that too.
it means so with so much hope
Mm.
that, again, the resilience of the human being, but also the potential to come back to that highway.
Yeah, I have never thought about that. I had a little light bulb going on. My version of that, which is so less poetic, is it's not true you get what you get and you don't throw a fit, right? But that's not but what we're saying is when you have this idea of these pathways being damaged, we think of broken highways or we think of wires that are cut. And so now we can never have that back. But that's not true. We've adapted to go around that. And the power, I'm sure you've experienced it over and over again throughout your many years and my many years of work, of when you see somebody starting to develop those pathways that they didn't even know that they were bypassing. Like it's almost like, there's this road and it's been there this whole time, but you keep going around it, but you never knew that there was a detour sign. You never assumed that you could do anything else. And all of a sudden you start to travel down that road, the light that goes on, the avenue, the access that one has. So just this idea of thinking it's not broken. It is just, we have an adaptive pathway. And as we can teach our system, right, to go through that pathway, then we have such a wealth of connection ahead of us.
And possibility.
Yes.
Possibility. The term, there's always the possibility for repair, has true depth of meaning
Mm-hmm.
from a scientific perspective, not just a behavioral perspective. That
Oh, yeah.
we can truly, and that's what I call embodiment.
Okay.
That I think that many of the adaptive strategies that we acquire to do the best we can with what we have are energy consuming.
Mm.
And that the original design, which is in our DNA, is the road of ease. That's just how I think of it. So we've just, in our adaptations, we're using up energy to create relationships that require more vigilance and attunement than just falling into that ease of relationship. But it's still in us.
Mm-hmm.
And so it's finding it, remembering it, knowing it, and embodying it as a reference point, and not one that's sustainable,
Yeah.
but one that is findable
Mm-hmm.
within.
Mm-hmm.
So that, again, it's not just how do I be in relationship with other, but how do I find safety in my own self
Right.
for the place of health and well-being.
Well, and how do I learn as I start to have more insights if I'm out there as a listener and I know that I have these adaptive patterns inside of us? Or, of course, there's all sorts of different avenues that would lead to that bypass. There's neurodiversity, there's falling on a spectrum, there's all sorts of ways that our system, our nervous system, needs tending to and needs to be able to find a place of safety. Because as we mentioned before, it's in relation and it's in safety, right? I'm not going to go down that road if my alarm bell is saying it's only hazardous. It's like, I'm going to keep going this well worn. So teaching ourselves and learning, which is not always cognitive. And this is where I feel like um, occupational therapy and other avenues of therapy, like you said, the embodied therapies. I'm curious, different forms, like the idea of sounds, how our body responds to sounds. Could you speak to that? Um, how's the connection between the way that we auditorily process
Mm,
connected to this?
brilliant. In the last little bit of our conversation here, you had me tracking and holding on to questions that you asked earlier.
Mm,
And one of the things I want to talk about tracking. So one of the things that you talked about or mentioned, which brings me back to Steve Porges, is this concept that he describes as neuroception.
mm-hmm,
And neuroception is a sensation of knowing danger and safety that is funneled through all of our sensory systems, informing the brainstem without cognition, is what I'm experiencing right now a place where I need to up regulate my attention for danger? Or can I rest and restore and stay in a place of ease and rest into our relationship? And when the cues, our brain is a predictive brain. So if my reference point in my body is one of danger, then I will assume with with more readiness that danger is going to be what's going to happen.
Mm-hmm. Mm-hmm.
And what I think therapy does, good therapy does, I don't even like that word good therapy, but it's the
Yeah.
best one
Yeah.
that comes up. Deb Dana just stepped into my mind here.
Mm-hmm.
What well, loving present therapy does is give the person a new normal of safety in context of relationship, which for many of our clients may be the first time. So that the nervous system then goes, oh, is that what this is supposed to feel like?
Yeah, you don't know what you don't know.
You don't know what you don't know.
Mm-hmm.
So you asked me about sound because sound is one of the sensations that is highly uh, pivotal into danger or safety cues. That certain frequencies of sound are received by the nervous system as bandwidths of vigilance. So high frequency sounds and low frequency sounds are in a bandwidth that only certain parts of the nervous system will attune to or orient to with very rapid speed to
Mm.
say to the rest of the brain, look out.
So the low being kind of like a growl,
Yeah.
or the
Or an
high. So
earthquake
or
sound.
oh, that makes sense. Or the high. So our auditory system has its own way of tuning into what feels threatening.
Yes.
And there's universal ways, I imagine, that universal sounds like you said, the low and the high. Information that was imagined through experience. We also learn different things that is threatening to our body.
Yes.
Yeah. So the
But this is
process.
our innate design.
Yes. Yes. Yes.
Right? That these, I always
Mm-hmm.
say, if you were a caveman in the cave and the saber-toothed tiger was, in the distance, you'd hear long before you knew or saw.
It's so true.
And
We pick up the senses. We don't see it. We pick it up so unconscious and under our awareness.
yeah, and that's why
Yeah.
we're here still
Right.
as a
Exactly.
species, right?
Our frontal lobe does not help us when
It
that is
just
happening. Yeah. If we waited for that, we'd be in grand trouble.
and so the cues of motherese, human language,
Mm.
have a different pathway. And here's where polyvagal theory comes in. That a branch of the ventral vagal branch, the ventral vagal complex, which is the social engagement component of the vagus nerve, is responsible for attuning the ear to human voice.
Mm.
So this, when I am in the neuroception of safety, this information is fed forward to my ear to allow me to stay in connection with you through
Mm.
language. But in the presence of danger, perceived or real, this branch becomes disadvantaged. And so the use of modulated music that is designed to bring into the foreground the experience of mid-range human voice
Mm.
sound with the removal of the high and the low frequencies is, in a sense, giving
Mm.
the brain exposure to an exclusive experience like a doorway.
Ah, so the exposure to those. So if let's before we dive a little bit deeper than that, let's just assume if we knew nothing about polyvagal theory, how would you say that? would you help a mom understand that who doesn't
Mm.
understand the beauty of the polyvagal language?
Well, I'd probably say to that mom, have you ever noticed how when you whisper and sing and you use your voice, I'm doing it now, when you talk to your baby, what happens to their eyes? What happens to their breath? This is tracking. What happens to their body? That in response to the cues that you are sending through your voice, you are deeply affecting the nervous system of your child and allowing them to learn from you how they can take care of their own nervous system.
Ah, that's a beautiful way to say it. So in speaking specifically about music and finding, and I've been really excited as I've been exposed to Steve Porges, the Safe and Sound protocols. I'd like to talk about that because that's part of what he has come up with is a way for somebody to be exposed to this range in a way that to enough consistent time period for
Mm.
the brain and the body to find that sense of safety. Am I getting that accurate at all?
You are.
So,
If I think about the intention of the
mhm.
Safe and Sound Protocol, which is the genius of Stephen Porges, is the mechanism of access to the nervous system to better receive the cues of safety in the presence of a loving and engaged relationship. So, to be clear, the music doesn't do the work by itself.
Well, so tell us about the Safe and Sound protocol so that people out there that don't know what it is can be tracking us.
Okay, so the Safe and Sound Protocol is modulated music. Modulated means it's passed through a special filter,
Hmm.
typically computerized, that takes familiar music with human voice in it and removes specific frequencies so that the listener is receiving the bandwidth of human voice that is specifically designed to access this branch of the nerve that is about relationship.
Oh, wow. Okay.
Okay, so the music comes in a package, meaning there are different levels of complexity to the music that ease the nervous system into this experience. And
Mm.
in order to receive the Safe and Sound protocol, the person delivering it, usually a clinician of some designation, has to be trained
Hmm.
because the training requires a lot of knowing of what you are seeing in the client that is with you.
Oh, that makes sense.
So that tracking process that you said, how do I know? How do I
Hmm.
know that this person is disembodied or embodied or starting to get more stressed or starting to relax? That the clinician who is in partnership with the client is able to watch, wait, and wonder. That in the presence of this music, do I start to see changes in the color on the face, dilation in the pupils? Um, those are indicators of, whoa, what's just coming at me?
Mm.
Does the client hold their breath? Do they start to cry? And the capacity of the therapist to meet the client in their experience, to me, is a emulation of what a baby might hope to have in the context of secure attachment.
Wow. Okay. So it's giving that, and so I imagine if the music is set as such that it's hitting your body, and I love the example as if in the same wavelength, because we're talking neurobiology here. We're talking a very sweet sound, but what we're talking about is neurobiology, that the range of the music coming towards is very specifically designed in a very intricate professional way to be able to hit this range so that the body's nervous system bypasses the intellect, takes in this information and takes in this music that is sending the nervous system a signal that of connection and of safety.
Yes.
And I can imagine some individuals just soaking that in and relaxing and falling into it. And I wonder too, if somebody that is an unfamiliar experience, it could actually set a sense of like, just like a therapeutic alliance. Sometimes the care and empathy, for some people, soak it up. For other people, it's, oh, what do I do with this?
For
Is that
sure.
right? Like the nervous
How
system might respond in a slightly anxious way to coming down to this frequency if we have learned over a period of time to stay in a protective state, in a vigilant state, or a disconnected state, then teaching the body. So I guess that makes sense then why the protocol happens over a period of time. Is that right?
correct. And again, you said that so beautifully that, for example, if a person's nervous system spent however long it needed to protect them through dissociative disconnection, that this activating opportunity through this channel of sound can land them into an experience in their body that may be positive but completely unknown.
Mm-hmm.
And the unknown is scary. And if I can't simultaneously feel felt and contained and know that I'm comfortably uncomfortable in the presence of someone that can hold that space with me, then I may just move right back into disconnection and dissociation.
That makes sense. Yeah.
So I
Yeah.
think it's the right and the left hand about the safe and sound protocol is both the stimulus of the sound as a portal to connecting into relationship in a meaningful way that provides that triangle for the opportunity for healing. And that's how I
Uh,
would describe it, I think, to a parent
I
or
love that.
to an adult.
Well, and as a therapist, um, I could imagine that it is such an avenue to be able to reach a client that so wants to find a different path for regulating their help their client regulating emotions or coming into emotions without the avoidant pressure to push
Mm.
away or the vigilant, like. And if you had a close relationship where you could read them and yet you were able to know how to utilize this, you would have a pathway that isn't a verbal pathway to really help process and find the unknown, bring the unknown to the known, bring the safety in.
Well, I'm recognizing right now that I'm speaking to a master clinician who could, and those of us who are relationally informed, we can rewire the brain all by ourselves. What's cool about a sensory support is
Mm-hmm.
it's actually adding another element of the nervous system's cooperation, for lack of a better word,
Mm-hmm.
that's at a very rapid speed and underneath consciousness. So a lot of times that co-regulatory dance that sits in the mix of psychotherapy is doesn't always get to that 1 centimeter above the spinal cord.
No matter, it's so hard to do that over a period of time, right? And it feels like this is a way, I mean, it sounds strange to put it because we're talking in such loving and connecting ways about something very important. So it seems funny to say it kind of expedites something
Mhm.
important. Like it's an
Mhm.
avenue to expedite
Yeah,
what may take years, is what
for
I'm hearing.
sure.
Yeah.
Because in a baby, this is where they live,
Hmm.
in their
Hmm.
brainstem. And in an adult, there's so much on top of it.
Oh, yeah. Just
Right.
also what you have to deal with when the minute you walked out of the therapeutic office, right?
Correct.
Like to be able to stay. So being able to have an experience by a trained professional going through the safe and sound protocol, it it is a way of working with your nervous system. And again, I say kind of in a funny way, in an expedited way, even that wouldn't be the goal. I mean, expediting in terms of finding and forming safety in your body, but it's another avenue. It's another resource and something that has been shown to be really powerful to be able to slow down and develop that sense of safety that bypasses that conscious awareness.
I think you might relate to this concept
Mm-hmm.
that I can that I is a difficulty for me. Early on, many times I would say to a client, "Can you sense that?" Or the question, "How does that feel in your body?" And they look at you like you have a rhinoceros horn in the
Oh
middle
yeah,
of your
yeah,
head,
yeah.
right? This idea of how do I think feel?
Mm-hmm.
And so, in a sense, what the sensory systems do is turn up the dial on the exaggeration of the information through the senses in a tolerable valence so that consciousness can catch it
Hmm.
without having to consciously, effortfully go try to dig it out. That
Right.
if there is this, I think of our mind body connection like a soundboard in a DJ uh, nightclub. And if the sensation piece gets dialed up, then the brain goes, oh, what's that? And the consciousness, it arises through consciousness rather than cognition having to go get it. And the capacity for sensing and knowing becomes a little bit more possible.
Hmm.
So that's how
That's
I think of this meeting place of mind
mm-hmm.
body. And I don't like to use the words top down, bottom up because it's such an integrated brain and they're really working together all the time. It's just what part do I access first and when to
Mm-hmm.
support the person in front of me? And that's, based on our detective work.
Mm-hmm. Well, and if you have, for whatever reason, developed an adaptive path around connection, right? Then we're talking about how then you don't have. I mean, I'm sure you've had this experience too of having. We mentioned before, like the light bulb go on when somebody has engaged with their defenses in such a way that they are able to bring them down, and all of a sudden feel a deeper connection. It's like this startling. I didn't know that existed, right? I love that experience. It's just such a rewarding one to hit that. And I mean, I could relate to that feeling of how do you feel? I don't have any earthly idea. Like in that moment, how do I feel? I can feel lost as anyone in that question. Um, but as an occupational therapist, one of the things that you're focused on is helping people tune into those senses that they bypassed or to not feel guilty about not knowing. Sometimes we have to teach people what feeling words are and to be able to relate to them. And we're working on that being very non-shaming and compassionate and adaptive. And so I love bringing ideas about how we can reprogram our body, if you will, to take that other path towards connections,
Mm.
um, in a safe, oh, I guess, come back to the safe and sound, in a safe way, in a way. And I think a very relieving way that it's not always intellectually asking, can you tune into your body? I think that's even hard. How do you feel? And so the idea of imagining that experience happening through the sound sounds like it's incredibly powerful.
I think one important caveat that I just want to emphasize is that I'm known for saying that
Sorry.
it's okay. I have one of those too, who's been very helpful today.
Thank you. Okay.
Yep. I'm known for saying publicly, calm is overrated.
Mm.
That connected is the ability to be comfortably uncomfortable.
Mm-hmm.
And that's what regulation is to be able to actually connect into all the feelings that are possible that arise in my body
Oh, yeah.
and learn how to contain them in a way,
Mm-hmm.
not suppress, in a way that I can actually use them as information. And if I'm disconnected from those feelings, then they sit there in my tissue in a suppressed manner.
Because your
Or
body knows that they're there, whether your
exactly, yeah,
intellect does or not. Yeah.
right. And so I guess what I want to say that in this journey
Mm-hmm.
into the safe and sound program, into the, and I call it the safe and sound process,
I like
lovingly.
that. Yeah. It's
Yeah,
a
because it is
process.
a process, not
Yeah.
just a
Yeah.
protocol. Is that sometimes it's not always enjoyable,
Ah, that's hard to imagine sitting and listening to say more.
right? And that, well, because as I connect into you,
Mm-hmm.
I'm connecting back into all that's possible within me. And some of it will be, I will not have any experience in knowing what it's like to feel angry, knowing what it's like to feel scared in a safe way, knowing what it's like to feel overwhelming love and joy, like the valences of the possibility of the human emotional range
Mm-hmm.
are all in
Mm-hmm.
us,
Mm-hmm.
but we don't all know what that's like.
Mm.
And so the
Yeah.
experience of music in the context of connection can take you to unknown. And so through safety, there's expansion. And that's where I think of evolution.
Wow. Yeah. That thought of those emotions or those things that you've been blocked, feeling like if your body is learning through this experience you mentioned over a period of time, as your body keeps experiencing this safety through this music that it is communicating, wait, you're safe enough, that's the process you're meaning. And the more that your body is allowed to experience that, I think what I hear you saying is that those defenses that have pushed out information get to relax, and so you have more information coming in and more of what you've blocked, and that's the part you're saying could be uncomfortable, but it is so important, because by it's the blocks that are stopping us from connection, right? If we imagine that road towards a deeper felt, and I guess I also want to clarify, when we're saying connection, we're not just meaning relationships. We're meaning connection to ourselves, to be able to experience our own feeling of connection more deeply in those things that we've cut off because we haven't had the privilege, if you will, to go there. So when our body calms down enough to say, oh, wait, we're safe enough, I can let this other information, you really need support for being able to recognize what that is and what the discomfort is.
Mm.
But at the same time, if we just take the time to go through that, the avenues that we have open to ourselves is really powerful.
I'm elated at the beautiful creation that we have had in this conversation
It's
of
been very fun.
unpacking these concepts. It's just come out in ways today that I have not really settled into before. So,
Oh,
yeah.
well,
And
same
that's the
here.
beauty of what happens in in the context of a relationship is
Yes.
you create something new. And I
I
really
love
love
that.
what this dialogue has brought out today.
Me too. Me too. I feel so much more enlightened about this and excited about the ideas and excited about our listeners getting to kind of anytime we can expand the opportunities. You and I were speaking to begin with about that's just our passion is like, oh, there's these ways that we can form a more secure connection to ourselves and a more secure connection to other people. And the ripples of that, right? The ripple of somebody going through this process, finding more safety to have whatever that is, less vigilance or more awareness of internal experiences. The more we do that, the closer we feel connected, and we don't have to all activate and stay activated in that protection system that blocks us, right? That's controlling so much of us. So maybe I want the safe and sound protocol music daily on our music speakers across the country and across Canada. I don't know that Canada needs it as much as the United States,
Oh,
but I guess we all do, don't
yeah,
we?
we all do. We all do. And as
All
long as
right.
there's someone on the other side of that music, we might just benefit from it. So,
I love
yeah.
that. And I love that point. I'm really glad that you're coming back to that point. This is especially crafted music
Mm,
that is designed to hit at a very important level. And so you need training and understanding because this is some important work that you're doing.
mm.
Um, so you need somebody on the other side ready to catch you just like an infant does.
You
That's what's
bet.
going to make the difference.
You bet.
All right. Thank you so much for joining us, Kim. It's been just a joy.
Thank you, Anne. And thank you again for all the work you do in the world.
Absolutely ditto. All right. Thanks so much for joining us, you all. I hope you have gotten as much out of this conversation today as I have with Kim Barthel. And
Right?
so you can find the Safe and Sound protocol through the company Unite. And Steve Porges is the primary developer of that. So it's based on deeply found research and study. And so I'm very excited about that. So check out Unite, or you can go to our website if you would like. There's no connection. So that's whichever way. But we just wanted to send information about something we think is really, really powerful in the world. But we will have all the information in our show notes, as well as how can anyone reach you, Kim, if they're interested in.
Oh, thank you, Anne, for asking that question. My website is www.kimbarthel.ca.
Wonderful.
Yeah.
All right. And again, that will be in our show notes.
Great.
Thank you so much for joining us, and we will see you around the bend.